So I came into Dr. Emer for acne scarring because he's the best there is. And I did CO2 4 days ago, and I'm coming in for an oxygen facial to speed up the healing process and increase the peeling.
Hi everyone, it's Candace at Dr. Emer's office in West Hollywood, and I'm here with a patient who had CO2 laser done. How many days ago was this?
4.
4. So he's on day 4, and we wanted you to see what the skin looks like because people are really intimidated by this treatment. It is one of our bigger procedures here. It's full ablation of the skin, but really gets great improvement. And so this is what day 4 looks like. Not that big of a deal. We have some flaking here from scabs that are coming off. And you can see the underneath part of the skin is really pink, and that's great. It's actually a sign of collagen production, which is what we want. That's what we need to remodel scars. So we're doing a post-CO2 facial on him, and this is something that's unique to our practice. And Dr. Emer has been doing this for a while, and he's kind of figured out the science behind healing. A lot of places we find people say that their downtime was like 2 weeks. We've gotten our downtime in about 7 days, and part of that process is doing these post facials. So I'm doing a very gentle cleanse here with an enzymatic cleanser. This is from Restorsea. There are enzymes in this cleanser that are derived from salmon eggs, and that enzyme eats away at dead tissue. Doesn't affect live tissue, so it's not going to create more peeling. It's just going to digest any of the buildup and help move this along. So we're just cleansing away, and we're going to do a little bit of oxygen infusion for him. And feel free to ask questions, guys. Nick, do you want to tell them what it felt like? Like, how has the healing been? And just even the bad parts, like, because there's a few days that you have discomfort.
A lot of itching. Itching is the worst part by far. Really tight, but that's manageable. Just can't really move your face.
Yeah.
But since the skin has started peeling off, the itching is basically gone today. So, yeah, mostly itching, a little burning, but not too bad.
And we give lots of products to help soothe the skin, protect the skin. The regimen's really strict, and like I said, we've kind of got it down to a science to get everything healing very fast. One of the key things to do or to not do is to not pick, not move any of the skin, not really rub. We basically want to just kind of pat when we're doing this, and during the home care, you kind of want to do the same thing. Just be very gentle with it because we don't want to force any of the scabs to come off. That'll, create more scars. We don't want to tear any live tissue. So we're just going to blot. And if you guys see this like green part, that's not an infection. Some people freak out. They see the yellow and the green and they think that that's a sign of infection. It's actually just because of one of the topicals that we give called BioShield. It just keeps the environment out of the skin since it's open. That's why it's green. But his skin is healing really nicely, so we're excited about this. And let's go ahead with oxygen. Do you have questions yet?
Not yet, just a lot of people watching.
So again, if you guys are just tuning in, this is an oxygen facial. We're doing it post-CO2 to help promote healing. I'm going to put a little bit of a serum on here. This is a healing serum with vitamin C in it, to help the skin just recover. And some more vitamins. Let's see. Actually, I'm going to do...
And somebody asked what serum that was that you just used?
It's a healing serum that we use. It's a vitamin C healing serum with a little bit of vitamin E in it as well. And then this is the 24 karat gold from Restorsea. So it's a facial oil that will help promote healing, but also has that same enzyme we talked about in the cleanser to digest dead skin. So we're gonna push that into the skin as well. And then I need my little machine over here. So now we're gonna do some oxygen. Let me load the gun up. So if you guys are tuning in, we did CO2 4 days ago on him for acne scars. And now we are doing a healing facial so that we can help speed up his downtime. Another big thing that we recommend for our patients is to do daily LED light therapy. This promotes the healing and helps create collagen production and also speeds up the downtime, which is always desired when we're doing these types of things, because who wants to have 2 weeks of downtime? I don't know where I put, oh, here it is. Can you open this? My hands are wet. Any questions about the CO2?
Not yet, but I'll let you know.
Okay, cool. So if you guys take a look at his skin, it's red here. That's normal. Again, he just had full ablative laser 4 days ago, so his skin's looking really good. He's healing very fast, and it's because he's doing these facials. We did one yesterday, and today's our second one. He flew in from out of town, so we're trying to we're trying to pack him in before he goes. And when he goes home, he'll still be on his regimen. He'll still do his skincare. We give vinegar soaks. That helps to encourage some of the skin to come off and also prevents infection. All right, so now we're ready for the oxygen. And this is a medical grade oxygen concentrator. You guys probably have seen these before, maybe in hospitals or whatever, but this little nebulizer, we can put whatever serums we want in here. So we have a lot of healing ingredients, hydrating ingredients. This is gonna help with the itching that he talked about and the tightness, and hydrate the skin. So we use these, you know, after all different types of treatments or just for regular maintenance facials, because they really, it feels good and it hydrates the skin. But for this, we've just seen that it helps with the downtime. It just speeds everything up. And, you know, for him to only be on day 4, this is, you know, he's made great progress. It's looking good. So this is gonna go on for a few minutes, and then we're gonna put a hydrating mask on his skin, and that'll just kind of lock everything in. And that's pretty much it. Unless there's any questions, I think you guys have probably got the gist, no?
No more questions.
Okay, thank you guys for tuning in. This was Post-CO2 Oxygen Facial.